Hi, Dr. Stephanie Higashi here. I am a chiropractor practicing for over 24 years, and I'm going to share a couple special things with you. My grandmother, who is 93, made me this bear and also this amazing doll, and the dress came from my Aunt Loretta's wedding dress material, I believe. But I'm going to go over today about babies. Yesterday I treated a 2-month-old baby to some really beautiful new parents, and there was a couple things that I didn't realize that I wanted to share that I didn't know parents don't always know. All right, let's get started. First thing is I want to tell you, my great-great-grandmother, Felicita, she had 15 children. My great-grandmother had 7, and my grandmother had 4. I had 2 miscarriages and haven't had any, although I knew I didn't want to have any this lifetime because I wanted to dedicate my whole life to being a doctor. But I want to share with you some of the training that I've done through Pediatric chiropractic that I did with the International Chiropractic Association, and some of the things I've learned as a doctor and what I've seen with patients. First thing is that basically my grandmother made this doll, so I'm going to use this as an example. When babies drink and eat food and bottle fed or breastfed, the food goes down like this. So sometimes when people are feeding their baby like this, the food isn't able to go down into the stomach. With the esophagus, it goes down, there's what is called goes up and down diaphragm, right? And then underneath the diaphragm and with the esophagus to the stomach is a little valve. So if the baby is still growing, that valve can be very weak and the food can come back up and then they can regurgitate. So to help with gravity, there's 2 things I recommend. One, if you are bottle feeding a baby, which you should always breastfeed if you can, but if you're bottle feeding a baby, that the baby's sitting up and it can drink like this, it'll help bring the food down or the liquid down through gravity. Also, if your baby has this, commonly in medicine, they'll say, oh, they have acid reflux, or they'll tell them that they need an antacid, which can block some of the absorption of calcium, which I wouldn't suggest if you can do these natural things first. You can do it this way, and if you're breastfeeding, I've even had mothers hold the baby like this and breastfeed in this position. You may need help because it is a lot of weight for your arms to hold the baby in this position, but it will help with the gravity to pull the food downwards. All right. Obviously, after the baby's fed, you want to, if you need to, gently have the baby belch, which you can go like this very gently. I want to tell you it's important because I've seen some parents that are really hitting the baby. You don't have to be aggressive, but what you should do is go upwards in the motion like this, right? You can also, if it's more comforting, hold the baby like this and again upwards. And this should help with that. I would also switch from side to side, 1, so your arms do not get tired, but 2, if the baby has a tendency for the neck to turn one side to the other side, to do that. All right, now, after many minutes, after the baby has maybe belched, let's say the baby's crying, comfortable with the food, there's something you can also do, which is just gently pulling the stomach down. In that case, what I would do is take the baby here, if here's the stomach, just very gently move the stomach down like this. And this can help get the gas that might be forming down into the digestive system. All right, now many of you have maybe heard about doing abdominal massages. One of the things with abdominal massages, you always want to go in a clockwise direction, like as if you're looking at the clock, because it goes ascending, transverse, and then descending colon. The way you want to massage is in little gentle semicircles. I usually apply a pressure equivalent to if you were pushing on a hard-boiled egg and not wanting to crack the egg. So it's that gentle. They're a baby, they're just first born. What I do is I go here and I do these gentle little massages here across like this, and then push down into here and get all of this bowel material and the gas, and it'll move it in this direction. So you do these little circles. You can just swipe around as well, but I find that the little clockwise circles tends to be more effective. The next thing is, you've probably seen them bicycle the legs, which if you do, you just want to do it very gently, right? You want to bicycle the legs gently. And then the last thing you can do is right underneath what's called their sacroiliac joint. You can put your hands and just gently massage up like this, which would kind of look like a motion like this, and that'll just get some motion into that joint. The nerves in the neck middle back and lower back, go to the entire digestive system. I definitely recommend seeing a chiropractor to evaluate your baby. They just went through a whole birth canal. My goodness, they've gone through a lot. It's good to have everything checked. One of the things too as a chiropractor that I usually do is I will check and I'll feel right where this sacroiliac joint is. You should Google what that term means if you don't know. I'll check and see if this is misaligned. I will check each bone, gently adjust it if it's actually misaligned, and then just get everything functioning correctly. So after treating this like super adorable, amazing baby yesterday, his parents were really excited because he started farting. He started having gas and he started moving things, and he was much, much happier and smiled the entire time. The last thing I want to talk to you about is breastfeeding. Breastfeeding is the most natural, healthiest thing you can do for your baby. It also helps you as a woman to burn a lot of calories in case you're wanting to get rid of some of that baby weight. It creates a connection and a bond with the baby, and it gives a lot of immunity to the baby, as well as a variety of different foods that you're eating then gets introduced to the baby as well, because what you're consuming then causes the baby to consume. There's a couple points on that. One, make sure what you're eating is very clean eating. You're not doing drugs, alcohol, smoking, energy drinks, or things that could be hard on the baby's system, like a lot of hot and spicy food, or if your baby has a lot of gas, you're not having a ton of gas-creating food like beans, etc. That's the best idea. Now, let's say for some reason you're not able to breastfeed. Let's say you are having to take a medication or you have some sort of thing wrong, right? If that's the case and you have to not breastfeed, but actually bottle feed, a couple different things. One is there's different formulas, and babies have different sensitivities to different formulas. So there are sometimes, like for example, some formulas that have a lot of additives, which I would try to stay away from because you don't know what chemicals that could cause reactions to in the baby. But the second thing, there's some formulas that are dairy-based. Well, you may not know, but some babies may have sensitivities to cows, lactose. They might not be able to process that. Many people do have dairy allergies, particularly, for example, like Asians. They may not be able to process dairy well. It would be problematic if you have that genetic predisposition to be giving your baby dairy formula. What are some alternatives? There are rice formulas, there are soy formulas, and one idea to consider is to actually rotate formulas. So maybe one day is a dairy, one day is a rice, one day is a soy. As long as your baby's not having allergic reactions or not displaying issues of sensitivity, you can rotate them, just because normally as the mother you would be eating different foods, and then those different foods would be different things that would be going to the baby instead of the same thing every day all the time, which could then cause some sensitivities. Those are just some little tips to think about. I really want all of the parents and babies of the future to be super, super happy and healthy.